Michael Tildesley is an Associate Professor of Life Sciences at the University of Warwick here in the UK. Michael, always a pleasure to have you on. What's the scientific evidence behind masks? I mean, it has changed a little bit over the past few months as far as the WHO is concerned.
Yeah, so I think probably most scientists agree that there is some evidence that wearing a mask will reduce your risk of transmitting the virus to someone else if you are wearing it. Slightly lower effect on the risk of you becoming infected by another person if you're wearing a mask. So I think that's most of the scientific community would agree that that evidence is there. What's more tricky, and I think why this is becoming a difficult debate in the UK at the moment, is the issue of wearing masks should not be considered a substitute for social distancing and good hygiene measures. So that's very crucial, that at the point that masks are being introduced, the concern may be that people may start to get more lax with other measures. Really, the best weapons in our arsenal are still social distancing and good hygiene practices, and a mask will help that, but should not be used as a substitute for us continuing the measures that we have been doing thus far to prevent the spread of the virus.
Yeah, but we could be getting into the issue there of a lack of clarity. For example, here in the UK, there's a social distancing advice of 1 metre plus if you can't avoid the 2 metre distance, which is actually the optimum in terms. And here we're talking about the respiratory droplets, Michael. Now we have more and more scientists saying that aerosol transmission, which are even smaller, really tiny particles that can hang in the air for up to 3 hours. And what about the effectiveness of masks regarding aerosol transmission? Because it does, we believe, as you've been saying, work in terms of stopping the spread of transmission in terms of respiratory droplets. But what about those smaller particles?
Yeah, so in terms of aerosols, and again, the evidence is growing a little bit in terms of aerosols. There's been some work that has suggested that in very crowded environments, there is the possibility for this virus to become aerosolized. And of course, wearing masks can potentially prevent those droplets. The issue is that obviously the smaller droplets, it's much easier for them to penetrate through the masks. The larger droplets are more likely to get caught. The issue around aerosols, where the WHO has suggested recently that there is strong evidence that people can be infected through aerosols, but in these obviously very crowded public places, there is more droplet transmission also. So I would say when it comes to masks, there's a higher protection over droplets. There will be some protection over aerosols, but of course, it slightly depends upon how the masks are worn, making sure they're tightly fitted and so forth, and of course regularly changed. That's crucial, that the masks, you can't wear them for a long period of time. They need to be either changed if they're disposable or regularly washed if they are use again types of masks. So these are really important things we need to think about if and when this policy were to come in.
Michael, if we look at the global situation and when you examine the figures, all the models that you work on, are you able to draw a conclusion that the countries that have followed the science more closely have been more successful in diminishing infections and the number of deaths? Can we reduce it to that basic an equation just for a moment about following the science more or less closely?
So, it's actually really difficult because actually following the science in general is a really, really broad thing to say. We can look at the science of, say, the timing of introducing lockdown, for instance, the timing of relaxation of lockdown and how that exactly is done. And of course, masks form part of that equation. The problem we have is it's very dangerous looking at other countries and comparing mask-wearing countries to non-mask-wearing countries, because all of the other policies were also somewhat different. Plus, of course, the population densities are different. We know that the higher population density cities such as London are much more susceptible to large rates of infection. So it's really, really tricky. I think there is some evidence to suggest that mask wearing can help, but I would say I would sort of err an element of caution in drawing too many conclusions in comparisons with other countries purely on masks, because there are so many other different interventions and the way that they are put in place that slightly muddies the picture and makes it really hard for us to tease out the effectiveness of masks in one country compared with another.
Really appreciate it, as always, Michael. Michael Tildesley from the University of Warwick.